Hello. Hi, everyone. Hi. Welcome to the inaugural Colorado Association for Recovery Residences Summit. It's exciting, right? Awesome. My name's Kaylee Peterson, and I'm a sitting board member of CARR. I've been on CARR, the board of CARR, since almost the inception because I strongly believe in CARR's purpose. A large part of that purpose is to provide education and clarity on important topics, anything you guys want to discuss or are struggling with. And we strongly believe that CARR wants to bring everyone together and provide unity in the industry. So I hope today that you can focus on engaging, learning, growing, providing us any insight so that we can better help to support you as well. So I'm extremely grateful to be here today, and I feel like it's amazing to be a part of the community we have here in Colorado. And so with that, I'd really like to introduce our board members. So when I call your name, if you can please stand up. Gonzalo Arvidin. There's Gonzalo. Thank you. Matt Neptune. Not here? He's on the way, probably. Rourke Weaver. Richard Montoya. Dara Keller. And Tanya Wheeler. Awesome. Thank you. And with that, I would like to pass it over to our executive director, Butch Lewis, who has worked tirelessly to put this event together for you guys. So thank you. I'm excited to spend the day with you guys.
I want to thank you guys for all coming out here. This summit, the bringing together of all the recovery residences in Colorado, has really kind of been a dream of mine for many years. I know it's been a dream of Rourke's when he was one of the founding board members of CARR. And I know that people like Scott Muntz and Eros Munson and Kaylee, when recovery residences really started coming to take their own in Colorado, we had a vision of being able to unite and bring the recovery residences together. And so CARR was really kind of born out of that vision. I want to note that this event would not be possible without our sponsors. And without these sponsors providing things like the food this afternoon for lunch with Palmer Lakes, all the snacks throughout the day have been sponsored by COPA. And then Big Creek Productions, which produced the book that's on the table, really kind of stepped up and helped us be able to provide the recovery residences with a Class Act A1 opportunity this afternoon. So I want to note a couple things. In regards to there's a notebook on your table. Throughout the day, we want to encourage you that if you guys have questions that come up, to write those questions down in those notebooks so that at the end of the day, we're going to have a panel with 6 recovery residence operators. And we want to be able to take those questions and be able to give you a diverse answer to those questions, because we know there's no one single pathway to recovery. We have many different programs that are out here that represent many different facets of recovery. And so we try to put together a diverse panel this afternoon so that when you guys have questions that come up throughout the day, they can answer those diverse questions that you guys might have. But to start off, I really want to talk about a situation that happened just recently. And I was able to talk with a family, and they really encouraged us to be able to share with you guys the situation that happened. As many of you guys might know, a couple weeks ago, we lost the executive director of one of our larger, stronger programs in Colorado to an overdose death. And so I want to start off this summit with a moment of silence for Blake Johnson, who recently passed away. We have a memorial table over here, and the reason why that memorial table's there is it represents one chair, Blake Johnson, one of our fellow colleagues in the fight for recovery and a fierce advocate. And the other chair represents all of the friends and family members that we have lost to overdose death over the years. So if we could just have a short moment of silence for Blake. Thank you guys for that. So I'm going to go ahead and address this now. In the last 120 days, it has been brought to CARR's attention of 3 return to uses from individuals that had acquired medications or illicit drugs when they were intaking individuals. CARR is here to represent recovery residences and to represent you guys. And so we're asking for your feedback today in a new policy that we'd like to adopt. And again, CARR never dictates the policy and how you guys operate. That is not what we're here to do. What we're here to do is to work with you and refine those policies so that it makes it both safe for the client and safe for the organization. And so the policy that we're asking for your feedback and opinion on is whether or not we should adopt to the CARR standards the adoption of a best practice around how to handle confiscated drugs at intake. And so that we can create and work with you to create policies and procedures on how we handle those medications when they come in and you find illicit drugs on an individual. And I know from talking with you that many, many programs have found confiscated materials. I know back when I was operating David's House in Sparrow, we had found everything from nunchucks to brass knuckles to, one time I think we found a bag of heroin about this big on somebody. We really want to kind of address how that happens. So since we're talking about that survey, I want to address the book that's in front of you guys today. And we're going to get into this a little bit longer, but I can see that most people are picking this up and are already looking through it. So what we tried to do is to put together a manual or best practice guide that answers the question of what is a recovery residence do? What you guys do is difficult. And I will tell you that CARR is getting a tremendous amount of calls from realtors or people that are trying to skirt zoning laws and opening up recovery residences. And these realtors have found out that if they open up a recovery residence, that they can charge increased rents, and they think it's that easy. And unfortunately, right now in Las Vegas and in Seattle, Washington, there are 2 different organizations. Actually, one of them was founded by, if you've seen the movie Wolf of Wall Street, one of the gentlemen that went down in the whole Wolf of Wall Street situation is now peddling a program to start recovery residences. And so we're getting inundated with these phone calls from individuals that want to open up recovery residences. And we wanted to put together something not only that could support you, but that we could pass on to these individuals and say, look, this is not easy. You don't just get to open a building, put 4 or 5 people that are in recovery, or 8 or 12, in a house and just collect rent. I can't tell you how many phone calls that we get in the middle of the night or throughout the day on recovery residences needing support on difficult questions. And you guys have lived experience. You guys know this stuff and live it. And so what we want to do is kind of wake up the eyes to these potential people that are just trying to make a quick buck off people in recovery and say, look, the things that you guys do every day is difficult. And we want to support you guys in the difficult tasks that you guys have taken on saving people's lives. So right now, I'm going to start off with some good news. I think this is really exciting. To my knowledge, this is going to be the first time in Colorado that we've done a State of Recovery Residences report. And so just so you know, right now in the state of Colorado, there are 242 homes that are currently certified as recovery homes. Those represent 1,929 beds. We have, as you know, there's a carve-out in the House Bill 19-1009 that created kind of the recovery residence definition and the structure that we operate under. There's an exemption for some organizations, and it's amazing that both organizations are here today, but there's an exemption in that law, and we refer to them as legacy programs. And those legacy programs represent 15 beds, 15 homes, and 151 beds, and they're only made up of 2 programs. So if you're familiar with Sobriety House or Step Denver, which both run absolutely amazing programs, the legislator, when we created this, was like, these programs are kind of legacy programs to the state of Colorado, and we want to protect their heritage and allow them to continue to operate they are. So just so you know that's what the legacy programs mean. And then the other one is Oxford House. And as you know, they're democratically run, democratically operated, and they operate as a family unit. And so they also have an exclusion. However, we work weekly with Oxford House and have a great relationship and talk with them all the time. And so they provide us with data that we can incorporate in these state reports. And that they operate 118 homes and 961 beds. So the total number, for the people who weren't doing the math, is there are 347 homes in Colorado right now that represent over 3,027 beds. Those 3,027 beds, 1,891 of those are male beds, 1,137 or 36 of those are female beds. However, we have only penetrated into 18 counties in the state of Colorado. And so this last state fiscal year, which is, as you guys know, state of Colorado runs from July 1st through June 30th. And so this fiscal year, the governor's office has tasked CARR with rural area expansion. And through our support and help with individuals like Signal and Diversis, we have been able to expand or working on expanding recovery residences right now to an additional 10 counties. And so hopefully, by the end of this fiscal year, we should have penetrated into about 44% of the counties in the state of Colorado. And I think that is pretty amazing. So I want you to know, there have been 21 grievances filed against certified recovery residences in Colorado this last year so far. Of those 21 that were filed, what we found is that probably 60 to 70% of those grievances that were filed were from residences that were retaliating against the recovery residents because they were discharged for return to use. And so I want to acknowledge, we realize that. Of the other 30 to 40% of the recovery residents that had grievances filed, what happens when a grievance is filed is we have a conversation with the recovery residence program. We look at your policy and procedures. We compare the situation that happened to what your policy and procedures was. And if there's a discrepancy, we work with you to implement training and adoption of changes to your policy and procedures that come in line with Colorado law. To date, we have not had a single recovery residence that's ever had a revocation of their certification due to a grievance being filed. That is not what CARR is here to do. We are here to support you. We are here to work with you and to utilize the resources that CARR has to be able to support you better. I can't even think of how many decades of experience that the CARR board makes up. And when we have these grievances that are filed, if there's a situation that we don't know off the top of our head, we go to people like Gonzalo Ardovan, who's been operating recovery residences since electricity was founded in Denver. And we ask him, hey, how would you handle this situation so that we can provide you with other solutions and opportunities? It's your guys' choice on the guidance that we provide and how that is adopted. Here again, we don't tell you guys how to run your program because maybe what we're suggesting doesn't fit. And so we just have a conversation. In the state of Colorado right now, we have had no new litigation or denial of reasonable accommodation from any county, municipality, or township that I'm aware of. Now, if a recovery residence is trying to put 15 people in a 1,500 square foot home, that is not reasonable. And so a request like that may be denied. But as we all know, a lot of municipalities have a law that says you can have 4 or 5 unrelated individuals. And here again, I don't want to go on what Jeff's going to be talking about later this afternoon. But we have been able to work with 7 different counties that were trying to stop recovery residences from being able to operate within their township because of those zoning regulations. We were able to have a conversation with them, and during that conversation with city attorneys and their mayors, they have come to realize that recovery residences, 1, are a good thing, and 2, they'll have to pay a lot of money in fines if they do not support recovery residences. And so, to me, this is the cool slide that we have on here. Okay, something else that we are working on that is going to be coming up very soon is the RRAD system. And what that stands for is our Recovery Residence Administrative Database. We have created a system where you guys will be able to upload all of your policies, procedures, go online, and anything administrative with CARR is all going to be through a portal that you guys have, that you guys will be able to interact with. Eventually, all of the beds in the state of Colorado from recovery residences will be able to be tracked on the system as far as bed availability. This system is built and integrates in with the state system that new legislation that was just passed requiring ERs, detoxes, hospitals, treatment centers, anybody licensed to report their bed availability. These are going to be able to talk to each other, and individuals, probation officers, the public are going to be able to go to a single website and know anywhere in Colorado where there's a bed available. And I think it's an amazing and a testament to the work that you guys have done that the state recognizes the hard work that Recovery Residence has done and have incorporated us into that system. Okay, so now let's talk about this book. We've discussed how this book, one of the main reasons it was written is to talk about the hard work that you guys have done and to show that to individuals that may want to get into this field. I can't tell you how many times I've talked to recovery residence operators who have gotten phone calls from people saying, I want to start a recovery residence. How do I do that? I know that Scott has repeatedly had conversations with me about sharing his contract and supporting people. And while we can't give you sample policies and procedures because we want you guys to be able to adapt your own, we did want to provide you with best guidances in some areas. So the first thing I want to talk about is Colorado Revised Statute 25.1.5, which came out of House Bill 19-1009. This is what defines a recovery residence in Colorado. And when Bria gets up this afternoon, she is really going to talk about this a little bit more. But it's this is free from alcohol and non-prescribed or illicit drugs, which is really kind of a key component to a recovery residence. I think we would all agree with that. So in the state of Colorado, there are 4 different types of levels of recovery residences. And I know that when somebody's getting certified, they often ask, well, what level am I? And so I just really want to kind of touch base on what this is really quick. So level 1, peer-led, Oxford House. Level 2, almost everybody in this room is a level 2. All that means is you have a house manager, you have policies and procedures, and that you have house oversight. A level 3, and this is, I think, the one that confuses a lot of people. A level 3 recovery residence has paid staff that are incorporated into the program. Step Dimber, Sparrow, Tribe, to name a few. And there's others, and I'm sorry if I didn't name you. But those 3 all have paid staff that on a daily basis are interacting in the house, and that's what makes them a level 3. Level 4, and just to note, there's only one certified level 1 in the state of Colorado, and there's only one certified level 4. A level 4 is essentially a treatment center. So currently, and I'm using the word currently because there's changes to legislation that are happening right now, but currently in the state of Colorado, you can operate a treatment center and not be licensed as long as you're not billing insurance. And so we actually have a treatment center that is CARR certified, that operates and offers clinical services, and they qualify as a level 4. So on page 11, you're going to see insurance requirements. I want to clarify this. CARR does not have insurance requirements that we require you to have in certain amounts. We do require that you have liability insurance and insurance to protect your program. However, the reason why these numbers are there, because if you contract with the state of Colorado's court system, these are the these are the required minimum insurance requirements that the state of Colorado requires. So we have a lot of programs that ask, well, what should I do? So we put this in there and said, well, this is what the state of Colorado's court system requires you to do. However, as Kaylee mentioned, we have one of our board members, Dara Keller, right over here, and I told her I'm going to do this about 57 times. There's 57 references to seek legal counsel in this book. And so I'm going to tell you, except for one exclusion, I would actually call her because she specializes in healthcare law and has answered every question that we've ever had. However, she doesn't practice zoning issues, and so we have another law firm that's kind of the specialty hammer if we have a zoning type situation that occurs. But if you have this situation and you're wondering what to do as far as like insurance and some of the other topics that we're going to bring up, stop by Dara. I asked her to bring some cards, and you'll be able to grab one from her. Okay, so page 48. We talk about medicated assistant treatment. We're going to get to that a little bit later, but what I want to do right now is address the statutes that created that. So revised statute, here again, 25.1.5.108.5.2 says, if you are a recovery resident in the state of Colorado and you accept state funds, you must support MAT. And then it says, well, what is MAT? And then it goes on to have another citation. And that citation, all that citation says is that you have to support all 3 forms of FDA-approved MAT. So if somebody comes to you and says, well, my form of MAT is I want to smoke pot in my house and you can't stop me, that is not an FDA-approved form of MAT. The only 3 that are approved are methadone, Suboxone, and Vivitrol at this time by the FDA. So know that. I do want to address one thing. There was a case here in Colorado, and there's been a couple things that have come up in recent years around medications in a house. So I want to talk specifically about this case, the United States versus Ready to Work. Ready to Work is actually an organization, and this is case law that is used all over the United States, but Ready to Work just happens to be in Boulder and happens to operate a program about 5 miles from here in Aurora. And what happened in this situation is Ready to Work denied an individual admission into their program because they were on Suboxone. That person applied for reasonable accommodation, and Ready to Work said, as I think a lot of people in this room I have heard say the same thing, well, we're afraid that this individual will be nodding off in groups or will be nodding off in house meetings and will trigger other individuals. Department of Justice took Ready to Work to court over this, and upon advice of counsel from Ready to Work, they ended up settling this. And so I just want you to be aware of that situation. I'm also going to address another situation really quick that's happening right now. And part of the settlement agreement on this situation is I address you guys today and we discuss this. There is a situation where a recovery resident recently denied admission to an individual because they were on Vyvanse. This individual had a diagnosed learning disability and was prescribed Vyvanse for that learning disability. They had been receiving reasonable accommodation from a university that they were attending, and they had all the documentation for this. The parents asked for a reasonable accommodation of the recovery residents, and the recovery residents said no, it would be too much of a change for their program. This is where I'm saying you need to seek legal counsel and call DARA or another attorney when making these decisions, because in this case, the parents of the child happened to be a physician, and the mother is a very respected therapist in the state of Colorado and runs a major program here. So they knew the laws inside and out, and they contacted the ADA, and they filed a grievance with CARR against this program. And we had conversations with them, and what they wanted, they weren't going after money, but they wanted education around reasonable accommodation for individuals that are on medication into recovery residences. And so that's why I'm asking you today that if you guys get into these situations, please contact legal counsel and ask them if this would be considered reasonable or if we need to make an adoption to our program. Okay, the next section of the book is NIMBYism. I'm not going to talk about this one at all right now. While this is my absolute favorite conversation to talk about, for those of you guys who don't know, my role when I was at Sparrow, one of my roles was to head up the rezoning that we were going to. To this day, it's the second most contentious zoning. We had 300 people come to our zoning meeting when we had our community meeting. Jefferson County said the only one they've seen bigger was a Walmart going into the mountain communities. And so Sparrow is right up there with Walmart. However, Jeff is going to be talking to you guys more about this today. However, I do want to acknowledge one thing. Sparrow won that zoning rehearing. The community then turned around and sued Sparrow. Actually, they sued the county for abuse of discretion and kind of drug Sparrow into it. But Sparrow was totally in the right, did everything correctly, and is operating an amazing program up in Evergreen today. Okay, so the next section of the book talks about LGBTQ population, and I know that we have all had the challenges of how do we support individuals that are in recovery that identify as transgender or in the LGBTQ population. So myself and many, many people in the state of Colorado put together a best practice on how to handle those situations. Unfortunately, the state inclusion officer was unable to be here today. She was going to actually come up and speak to you guys about this particular chapter of the book. So I am going to actually ask that if you have questions about this section, to read through that. But I want to pause for a second, and I'm hoping that all three of these programs are here. But Just Living, Heart Mind Haven, and the Don't Look Back Center. All three of these programs specialize in working with the LGBTQ population. And so if you guys have a situation that comes up and you don't feel like your program would be the best fit for an individual, I would highly encourage you to make a referral to one of those three programs. And if you didn't have a chance to write them down, this video will be made available and you can contact CARR because we are continuously adding support for the LGBT population, and we want to continue to be able to support individuals and individuals' rights. So the next section of this book, we're going to talk about women with children. Studies have shown that 30% of women that are in recovery residences are able to regain custody of their children if they live in a recovery residence, opposed to the 12.8% of individuals that were not able to get custody back of their children, that did not choose to live in a recovery residence. But there's major things to consider when you're supporting a Women with Children's program. And those things are things like insurance, needs of both the parent and the children, because there's different needs for parents and for the children than what a regular recovery residence program would be like. Unfortunately, if anybody in this room has kids, we know that they are a terror on the house. And so your home maintenance is going to be different for programs with women with children. Bedroom space needs to be considered. Are the mom and the child sharing rooms like the program up in Greeley, or do they have their own individual rooms? Background checks. I'm going to go back up to that top bullet where I said, talk to legal advice, call DARA. Because there are different requirements for individuals that are working with children. Mandated reporter training. Do you guys have policies on watching children in the house? And can other parents watch somebody else's child? And what does that look like? Age of children. Once you reach 5 years of age, in the state of Colorado now, as we know, because of our great governor, who just won re-election, right now in the state of Colorado, kindergarten is free. All-day kindergarten is free, and I believe they're doing preschool also. And so these are things to consider. But what happens if that mother has a return to use and her child's in your program? What happens to the child? And so these are things that we address in this chapter and for things that you guys to think about. The next section is preventing and addressing relapses. And I really want to talk about screening, appropriate screening. If somebody has been on heroin for the last 10 years and wants to check into your program, and their last use was 30 minutes ago, you may not be the right program or right level of care for that individual. And so adopting some type of screening of residents would be appropriate. And so we kind of give you some best practices on how to screen residents, how to address relapses, supporting the other residents that are in the program, and then also an emergency response plan. What happens in the house when somebody overdoses? I know that work unfortunately got to experience a death in a recovery residence that he was operating. What was the response plan to those situations? As you all know, one of the CARR standards is that you have Narcan on each floor of the residence. Just so you are aware, our inspectors now bring Narcan with them and will supply you guys with Narcan for free for every floor of your recovery residence. And if you operate an apartment complex program, we will supply Narcan to every house, building, unit in that apartment complex. So we want to make sure that you guys have this life-saving drug readily available to you in case somebody relapses in your program. Page 126 through 122 talks about reentry programs. As we know, people that are coming out of incarceration, 65% of them have a reported SUD use. And so we have put together some best practices on how to work with this unique population that has unique challenges. Just so that you're aware, a new program just opened up in Denver. It operates 123 beds. It's a recovery program near downtown Denver, just east off Colfax Avenue. And they specialize in re-entry programming. And I know that there are a lot of programs that work with the Department of Corrections, such as Tribe, but Ananeo, and I believe they're here today, they 100% only work with people that are coming out of the prison system. And we need programs like that. I want to do a show of hands. How many individuals in here have received a phone call for somebody who is a sex offender that was looking for a placement? Okay. Now, raise your hand if you knew of a program that offered programming only to sex offenders. Okay, so we have 3 or 4 hands now, when almost everybody did. Okay, Mobera Solutions and I believe he's right over here with his hand up. I would invite you to see him. He operates the only recovery residence program that we have certified that only works with sex offender populations. And so you now have a referral source for all of those individuals that contact you that are looking for placement in a recovery residence that are registered sex offenders. So we talked a little bit about how people coming out of incarceration face different challenges. There's actually laws, federal laws, that restrict some of the things that they can do. Luckily, we have a very supportive state here in Colorado with a very supportive legislature, and we don't have laws like banning people from being able to seek Pell Grants if they have felony for substance use. However, we want to make sure that they are able to find employment. And this chapter talks about how to connect with things like second chance hiring. It deals with the stigma around coming out of incarceration, how to receive public benefits. We've included in this a release of information because many of the individuals that are coming out of incarceration still have contact with the probation and parole officers. And so we want to make sure that you guys had a release of information so you can talk with them. And so page 142 has that release of information. But at the same time, we want to make sure that we're supporting these individuals that are coming out of incarceration. So page 140 has a needs assessment where you can sit down with that individual at intake and find out what needs they have that might be unique for them. I know that the prison system is supposed to discharge everybody with 2 forms of ID, but I know I have talked to the programs that are supporting people coming out of the prison system that have no ID on them. And so one of the things that we talk about is how can we help support them in those needs? Okay, so here again, I'm going to kind of skim over this fair housing fact sheet, but this fair housing fact sheet was put together with myself and some of the city attorneys on how to deal with the legal situations around fair housing. And this section we put together in a way where we could take this section out, and this section could be then given to community that are pushing back on why a recovery residence could be allowed to operate in a single family home. And it answers all of those questions that these programs or individuals might have on why a recovery residence is actually a good thing for the community. And it talks about some of the ADA and FHA laws around recovery residences. So I need you guys all to turn to page 163. I need everybody to turn to page 163, and I need you to pick up a pen. So on page 163, you're going to find an area that says elements prohibited from policies. And the very first bullet point in that section says requirements for suggestions that residences waive legal rights. I need you to take a pen and scratch through that. Unfortunately, this book had about 4 or 5 different references to that particular standard. And I approached the CARR board, I think probably 2 weeks ago, and asked, we need to strike this standard from the standards. I have myself nor anybody on the CARR board knows how that standard originally got adopted into our standards. What happened is when CARR was originally writing its standards and putting them together, we were working with NAR, and we were working with a lot of the other state affiliates. And so what it sounds like happened is this is a requirement in the state of Ohio, and I didn't catch it. We will not have this requirement, because if we had this requirement, then people could drink in your houses. People don't have to abide by your curfew or your rules or any of these other rights. And we all know that we ask people not to use illicit drugs or to drink in the recovery houses. So the board voted 2 weeks ago, we're striking that standard from the policy and procedures. And just so you know, all these policies and procedures, anything that CARR does actually has to get submitted to the Behavioral Health Administration. It used to be OBH, now it's the BHA, and they have to approve all of our changes. Okay, so so I know that this book could be daunting, and it looks like we're overburdening you. So I just want to say one thing right now. There's only 2 changes, which we're going to get to here in a second. And there's only 2 changes in this book from what was in the standards of how you guys are already operating right now. But I want to talk to you guys about how the standards came about. And so how these standards came about is the legislation that created CARR said that we have to follow the nationally approved standards by NAR. And so if you were to go onto the NAR website and download NAR Standards 3.0, what you're going to find is every single one of the standards that we have, except in the physical environment domain, are listed almost word for word to what the state has. However, because NAR is a national organization, they could not create national policies around certain areas, and those areas are things like what your windows, as an example, are made of, look like in that structure. Because hurricane windows down in Florida are different than windows that you need in San Diego. And so what we did is we got together with all the municipalities in Colorado, and we created the physical domain. The physical domain follows the IRC, or the International Residential Code. We use the 2015 because that's the latest one that we could find in the state of Colorado, which I believe was Pueblo or Colorado Springs. We got together with individuals like the city of Aurora, and who does systematic housing inspections, and we said, hey, these are, help us to incorporate in these minimal standards. And these are the things that we're going to look at. And that includes things like egress windows, screens on windows. I know some people have been asking me, when CARR was originally started, screens and windows were there. Somehow it was a inspection item that was kind of overlooked for a couple years. However, what we learned is that's actually a building code in the IRC. And so just so you guys are aware, we will start looking at screens on windows again, because that goes to bug infestation. So that's kind of how the CARR standards have come about. Now, I said there's been 2 changes to the standards. So one of them is no longer are you required to have these stupid, silly emergency exit ladders on the 2nd floor. I can't tell, I met with the state fire marshal, I met with multiple jurisdiction fire marshals, we talked with the people that wrote the International Fire Code. Us, Oklahoma, Seattle, and a couple other states are removing that standard because nobody can figure out where it kind of came from in the first place. And the fire marshals that we talked to said that these damn safety ladders are more dangerous to try to get on and climb down than if you just hang out the window and drop 4 feet after you're already hanging down out of the window. So we completely removed these standards from the standard. So no longer will the inspectors be looking for these ladders on the 2nd floor. The one standard that has been added, we added critical incident reporting. We are working on what that means and the guidance around that for you guys right now. Unfortunately, around grievances and critical incident reportings, CARR adopts the exact same language that the state uses for treatment centers. The problem is that the state right now is changing their policies around critical incident reportings. They're not changing the statutes, to my knowledge. Unfortunately, as Daniel Darding knows, the state kind of changes legislation willy-nilly sometimes. And so we're waiting to find out how they're putting together the guidance around these, and they do a lot of that in rules, and so we're waiting for those rules. So we will have information that are coming down. But the reason why that we're adding this is it was brought to CARR's attention through some of the local law enforcement departments that some recovery residences were seeing an uptick in overdose deaths. And so they came to us and asked us for information and data. We then have a conversation with the state on this, and it was decided that it would be that CARR should incorporate in critical incident reports into the situations so that we can better serve you. Here again, I'm going to go back to no program has ever been shut down. Our goal is to increase support for individuals in recovery and to do bed expansion and service expansion, not to restrict programs. However, if we don't have data and information, we can't better support you. And so that is why we're including for the first time critical incident reporting into the CARR standards. The other document that's kind of new is something that you guys are already doing. I know you might find this shocking, but sometimes once our inspector leaves, some of the standards that have been applied, they may not do them the next day. And so what we have done is we have put together an assurance thing that kind of outlines some of the more critical policies, like I realize that I have to have insurance for our program. I realize that I have to file taxes or be registered with the Secretary of State. And so all this does is kind of call attention to those policies. So this is actually the most exciting slide, actually second most exciting slide, that I get to present here today. The county one I think was the most exciting. Colorado has been invited to participate in a research program with Stanford University and the University of Notre Dame in South Bend, Indiana. What we are going to be looking at is the question, do certified recovery residences actually improve the health, housing, and employment outcomes of those with substance use disorders? How this is going to work, if you guys were to decide that you wanted to participate in this research study, we'll have a conversation and make sure it's a good fit. But how this would work is when somebody calls your program and is seeking a bed, you would do your intake process the way you normally do right now. If you were to offer this individual a place in your program, mind you, this could be on the wait list or actual immediate entry into your program. You would then ask them, you would then pause right then and ask them if this is something that they would consent to participating in. From your perspective, what this would look like is you would briefly discuss the research study with them. You would invite them to participate in this and assign a consent form. That signing consent form is a very important piece to this because we do not enroll anybody into the study who did not give consent. If they give consent, Notre Dame is going to send them a $10 gift card through their endowment. And the other thing that your program will have to do is you're going to have to keep a log of the individuals that you offered or put on your wait list into your program. And then probably bi-monthly, you're going to do about a 10 or 15 minute check-in with Notre Dame's LEO program, which I think is, hold on, we'll go back, is the Lab for Economic Opportunities that's kind of running this program for us. From the client's perspective, what they're going to hear is they're going to have that phone call with you. Then they're going to have to answer some short intake questions. It takes less than 5 to 10 minutes to answer these questions. They'll receive that $10 gift card. And if they choose not to consent or they don't want to participate in this, then you just move on with your intake as normal and you don't even consider this program anymore. The reason I said that even if people get play on your wait list but do not accept into your program is those individuals that consented to participate but did not move into your program and went on a wait list, but then eventually did not go into recovery residence, those become our control group. And then everybody else that actually moved into the recovery residence becomes the recovery residence group. And so that is how we're tracking the outcomes, is utilizing those people that were offered placement into a recovery program but did not accept it to the people that actually did move into the recovery program. And so what we're going to do is we're going to track that individuals for the next 5 years. And so, but we will have absolutely no contact with that individual outside of that first 5 to 10 minute conversation that you guys have with them. But how are we going to do this and how are we going to track this? We're going to use things like the Medicaid enrollment system, the master death for Social Security files, and we're going to use all this background information to be able to track that individual success in these 3 different areas. So we're going to look at things like jail stays or incarceration and the homeless databases and SNAP benefits and all these different public accessible databases and information to be able to follow that individual for the next 5 years so that we can prove that recovery residences work. So right now, the current status of this project is being run in Ohio. They did the pilot program for this. They have 7 recovery homes that are participating in it. Those 7 programs, they've had about 1,100 people that have registered for the program. Unfortunately, they only have about 200 people that are in the control group. So we really have to be careful about building up those control group numbers because we want to make sure that our sample size is valid enough that we can be able to take these findings and do things like create academic papers that support the work that you guys do, create policy briefs so that we can change legislation that better supports what you guys are doing. And we can garner support from funders that gives valid data to the work that you guys are doing. And so, just some key points. This research study is completely free to you guys if you want to do it. You guys will have access to your own data, and it'll help you guys decide on changes that you guys want to make to your program. It's going to give you guys evidence that supports your program, that you guys are going to be able to take to receive grants. And it's going to give third-party validation to the work that you guys are doing from 2 of the top-tier universities in the United States. So I'm really excited about this opportunity. If this is something you guys want to pursue, please see me, and I will we'll set up a call with myself, you, and Notre Dame and Stanford, and we will have a discussion on getting you guys enrolled into this. So I really want to thank you guys. I wanted to leave some time, and I'm going to ask that my board members over here keep me on track as far as so we can keep on schedule. But does anybody have any questions? But before I take a question, I want to just note, I may ask you to write that question down if that's a question that's best asked amongst the panel this afternoon. But of any of the things that I mentioned today, does anybody have any questions? And I believe that we have a couple microphones.
On the mat treatment that you talked about, so if we don't want Suboxone strips in the house, are we allowed to tell the client that they can go to a treatment center to get on the Subligade? Does that count as mat treatment?
By the definition of the Colorado statute, it would. However, I know that a lot of people don't want the strips in their houses because of the potential for abuse with those strips. And I'm guessing that that's one of the reasons why you're asking that. So a lot of the pharmaceutical companies have created packets with extended release tabs that can be punched out and taken. And so that's the way a lot of the other states are addressing that, as far as being able to support the individual on MAT at the same time.
Would that be the subtext there?
That, I'll be honest, I don't know that answer down to each different physical component. Anybody else have questions? Okay, well, thank you guys so much. We are going to have a short break right now.